Good afternoon, everyone. My name is Aura. I work at the Mental Health Foundation Australia, and I'm your host for today's webinar. We begin by acknowledging the Wurundjeri Woi Wurrung as the traditional custodians of the land on which our offices stand, and pay our respects to their elders past and present. We extend that respect to any Aboriginal and Torres Strait Islander peoples tuning in today. On behalf of the Mental Health Foundation Australia, I would like to welcome and thank each one of you for joining today's Be Well educational webinar on drugs and mental health, essential prevention and education strategies, presented by Jan Kronberg and Tanya Cavanagh. Before we begin, a disclaimer that this webinar is intended for educational purposes only. It is not a substitute for professional medical advice and should not be relied on as health or personal advice. Always seek the guidance of your doctor, psychologist, or other qualified health professionals with any questions you may have regarding your physical and/or mental health. And also just a cautionary reminder that today's webinar will mention themes of substance use, addiction, and their negative impacts on mental health. If at any point you feel uncomfortable or distressed, we urge you to please close the tab, take a break, and practice coping strategies that work for you. Throughout this webinar, Jan Kronberg, National President of the Drug Advisory Council of Australia, also known as DACA, and Tanya Cavanagh, CEO of Teen Challenge Tasmania, will be discussing the need for realistic, extensive, and holistic approach to preventing the uptake of illicit drugs. I would now like to introduce our presenters, Jan Kronberg and Tanya Cavanagh. Jan has been the National President of DACA since 2015. DACA is an advocacy body and is affiliated with August bodies, both locally and internationally. DACA is comprised of professional staff and a cohort of talented volunteers from many relevant fields of endeavour and professions. Supported by 10 patrons of high esteem, DACA is actively working to become a charity with DGR status and works to advise decision makers as they strive to formulate public policy to offset the scourge of illicit drugs in society. Tanya Cavanagh is the CEO of Teen Challenge Tasmania. Teen Challenge is an international organisation that commenced in 1958 in New York by Reverend David Wilkerson in response to his exposure to the significant drug addiction to heroin at the time of the city's teenage gangs. Today, it has over 1,400 residential rehab centres around the world for people from teens to adults with life-controlling addictions. Teen Challenge was established in Australia in Queensland in 1981 and has residential programs in each state excluding Northern Territory, ACT and Tasmania. Please join me in welcoming Jan Kronberg and Tanya Cavanagh.
All right. Thank you very much. It's wonderful to be here today at this event auspiced by Mental Health Foundation Australia, and it's particularly pleasing for me to be joined by my colleague Tanya Cavanagh, who has flown from Launceston in Tasmania especially to be with us here in Melbourne today. And to the wide audience, we hope to provide some important information to you based on, from the Drug Advisory Council's perspective, in terms of empirical research and the advice of professionals in a number of fields associated with the impact on humanity of taking illicit drugs. And one of the areas I'd like to share with you and perhaps underscore, because here we are with the Mental Health Foundation of Australia, and we'd like to place the emphasis on and raise awareness about the fact that drug taking can induce some forms of mental illness, and it can also bring forth mental health disorders that might be genetically inherited. And so our message today is to alert people to that potential, and Tanya will be talking about ways to reduce risk. Some of the terminologies that professionals in the field seek to use are terms such as demand reduction, that is, getting a message out there so nobody wants to take drugs that are going to impact your health and your mental well-being and perhaps leave you with lasting problems such as infertility. So there are a lot of areas where people can reduce risk, and Tanya is in the front line in a lot of those areas. So what I want to do is just to get my statistics right for you today. I've got a note here where, and it derives from one of our experts with the Drug Advisory Council, Dr. Murad Ibrahim, and it arose from a webinar he conducted for the Drug Advisory Council just 2 weeks ago on the 31st of January. And this is really hot off the press information, and it's from an expert in the field of those who are suffering from taking marijuana or cannabis in its various forms. And some of the numbers compel me to share them with you. First and foremost, in Australia and New Zealand, we're second behind North America in the prevalence of cannabis. That is 12.1% or 3.4 million users. So a lot of people who are using that drug need to be alert to the consequences of that. Now, one of the things that concerns us deeply, and I think people as mental health professionals will appreciate that if people start taking drugs at a very early age, when the brain is forming, the consequences are very damaging, possibly having lifelong consequences. And so the most commonly illicit use substance is cannabis amongst adolescents, and this might be news for you, but it starts around about the age of 12 and ranges up to 17. So this is the most common use period of time, and it's also that period where the brain is forming and therefore most damaging. And parenthetically, I'd just like to offer this point, that's the fact that if you ingest a substance such as cannabis, it stays in the fatty tissue of the body. So it differs from other substances that people might take and become dependent on, especially alcohol. The body has a way of detoxifying itself, but it resides in the fatty tissue in cannabis and therefore has a long-term effect as a direct result of where it resides within the body tissue. And we also like to make the point that 21% of victims and offenders have consumed illicit drugs before a homicide incident. So the consequences are so damaging. Now, they say that 10% of users of cannabis have what's called cannabis disorder, and that involves, and I'm going to use everyday language here, not Greek or Latin words of the medical world, but everyday language, and we use it so commonly, but the consequences for the individual, the families, the people they associate with are really profound, even though it's everyday words. So if we think about cannabis use disorder, bringing about a dependence, a tolerance to the drug, a preoccupation through a persistent desire for use. So crowd your head. Spend a lot of time trying to obtain cannabis. It means if you're preoccupied with those things, you can't complete work. You can't complete recreation. You may not be able to involve yourself in sports. You will want to use it despite physical, psychological or social contact impacts. And this is the unfortunate part, withdrawal symptoms are relieved by taking more. The effects of cannabis use, everybody thinks it's an appetite stimulant and it's relaxation and it's fun. And it certainly does create a mild euphoria, relaxation and reduced inhibitions. So in social settings, you might find that you're more chatty, better with the small talk, approach people you normally wouldn't. You'd see an upside to that. However, in addition to that, you have an altered perception and judgment, including time distortions. Time gets away from you. An intensification of ordinary experiences. So you might overcook a situation. You'll have feelings of hunger. How hungry will you be? Will you overeat? Will you eat the wrong food? You have panic reactions, confusion, and sometimes feelings of paranoia. You have nausea and headache, increased heart rate for up to 3 hours after smoking marijuana or ingesting it, and dizziness and impaired balance and coordination. Now, the next points I'd like to make, if one is continuing to take cannabis, the long-term effects are thus the dependence, that word dependence again, we used that before, cancer, a number of cancers, 27 cancers in fact, some of the lung, some for young men, unfortunately, cancers such as testicular cancer, chronic respiratory disease, damage to the cardiovascular system, the entire system and on occasions, mental health conditions, and this is the focus of what we're talking about today, and poor psychosocial well-being. Now, in terms of building the bridge between taking of illicit substances, not given the focus on cannabis, other substances have an impact as well, but because time's short, I'm just focusing on cannabis now. The psychological conditions associated with cannabis use are depression, bipolar disorder, most especially if there's a genetic predisposition to bipolar disorder, psychosis, schizophrenia, anxiety disorders. In addition, PTSD, ADHD, OCD, poor adolescent psychological development, and social isolation. And if we think of that list of problems that may lie ahead for people who take illicit drugs, if there is a predisposition for mental health problems in that individual or something that they may have inherited genetically, you'd have to ask the question, why would you take an illicit substance to bring about all of these problems for short-term euphoria, stimulation of appetite, reduction of social inhibitions? Why would you do it? So I'll give you some further anecdotal information as we course through what we're going to be talking about, but I wanted to set the scene, which is one of the motivators of the Drug Advisory Council and how we spend our time. Now, my relationship with Tanya Cavanagh comes from the fact that at the end of 2021, one of those things that people do during COVID, we thought laterally, we thought creatively, and 5 organisations have come together in a coalition that we call the Task Force for Drug Prevention, so that has a universality to it, so those people outside of the professional sector will understand. If you start talking about demand reduction and harm reduction, the general public get confused by those terms. So the Task Force for Drug Prevention brings me into a splendid working relationship with Tanya, and I'd like her to share some of her experiences and infinite wisdom with us.
Thank you, Jan. Thank you, Aura. And hello, everyone. I'm very excited to be here. So as Jan has outlined, and particularly honing in on cannabis, we have a choice in this space, and there's some very real consequences. They can be physical, mental, social, relational, and so there is a consequence there. The space that I work in is working with people in addictions, life-controlling issues on an everyday case by case, and Teen Challenge itself works with residential rehab. So we work with a lot of individuals, families that are struggling in this space. But I also, in Tasmania, we don't have a residential rehab program, and I work very heavily into early intervention space. So mentoring with youth in primary schools and high schools that are potentially at risk of drug use or abuse. Maybe there is generational use and issues in this space. And invariably, we do find that mental health is usually connected in at some stage in there as well, either as a little bit sometimes like the chicken and egg analogy is which came first. As Jan was just saying, then why would people enter into substance abuse when you understand these? But a lot of people don't understand. And that's why education is incredibly important and bring the truth. And there's a lot of research that's available today. But one of the things that we particularly look at is causation issues, because no one wakes up in the morning and says, hand up, career choice, I want to be an addict. There is stimuli that happens in our life, and that could be things that we are choosing to do or things that are happening around us, or we're subject to it. Again, as I said, generational issues, social environment in which we're in, influences, wanting to fit in, be accepted where we are. And we make choices in how we respond to that stimuli in our life. Personally, I have used alcohol to actually deal or not deal with things in my life. And so I have some lived experience in this space as well. And so oftentimes we want to use a substance because it helps us not think, not to deal with what we're facing at that moment. We know, and I certainly know now, the more healthy way is to actually talk about with a professional, someone that you trust, to talk about how you're feeling, what you're going through. And I think that old adage of a problem shared is a problem halved is very, very real. But sometimes it can be really hard to take that step. So, through our mentoring, we do drug education in schools all around Australia. We've spoken to over 90,000 young people to educate, one, in how it impacts. And today a big thing is around vaping, which is, again, another delivery device of a substance. There's a lot of misnomers and misinformation that's given out to young people through social media. And particularly in the mental health space, there is actually promotion that vaping helps with mental health issues, so around anxiety, depression. And when we understand how the brain works and the level of nicotine that is actually in vapes, we can appreciate that young people, when they use the vape, particularly for the first time, and experience the nicotine, it does release some dopamine, it does help you feel a little bit better about the circumstances. But then when you come off it, that dopamine is not as available to you naturally, and so your anxiety is actually a little worse than it was before. So you'll kind of remember, well, if I hit that, it made me feel a little bit better, and you go back to that. But this time you need a little bit more than what you had last time, and then when you come off that, then your anxiety is a little worse again, because again the dopamine's not available to you as it should be. And so then you go back to it. And so the cycle I see with a lot of young people is that they're, again, using a coping mechanism with a substance, and most times not even realising that nicotine is in it. because a lot of the product doesn't list that it has nicotine in it. In fact, Dr. Kelso from the University of Wollongong is currently taking over 1,000 different vape products that's available here in Australia and testing them to what's in it. And 100% of those that say that they don't have nicotine in them or don't list that have nicotine in does. Highly addictive substance, which is a device that is designed for addiction. And will continue on to other use. And particularly, as Jan was saying, with a developing brain, for women, our brain doesn't stop developing until 25. For the males, it's 32. So the importance of any drug that we bring into our system while it's still developing has an impact on our brain development. And when I'm speaking to young people, I said, well, should we care about that? What does the brain actually do? Well, it does everything. Breathing, blood movement, building relationships, connection with our community, and mental health. It's vital. So we need to be educated in that space to have that understanding in that area. Over to you.
Oh, thank you. Thank you, Tanya. I think Tanya has made some really profound points. Now, coming back to the combination of having a mental health problem and being drug affected as well. I just want to turn to a couple of things because I've got some really important quotes to share with you today. And one of them, it comes from the United States, the National Drug Control Policy body at a conference under the heading of Marijuana and Your Teens' Mental Health. I went out of the way to alert parents of the mental health harms for teens of marijuana use. So this underpins the points I made, and those points derived from the research of Dr. Murad Ibrahim just from 2 weeks ago. And they say that there are links emerging from a body of research which identified links between marijuana use and mental health disorders, including depression, social thoughts, and schizophrenia. So they sent out an open letter to parents in the United Nations using media organisations, and this open letter was signed by 12 of the United States' leading mental health organisations, and they emphasised the risk factors for adolescent marijuana harms. And they said this: regular use of the drug has appeared to double the risk of developing a psychotic episode or long-term schizophrenia. Research has strongly suggested that there is a link between early cannabis use and later mental health problems. Now, that's the strength of some of our messages that we're sharing with you today, because this is particularly acute for those with a genetic vulnerability. And there's a particular issue with the use of cannabis by adolescents. And adolescents who use cannabis daily during the course of the development of the brain were 5 times more likely to develop depression and anxiety in later life. These are the sorts of things some people could say that they're life-changing. They could be calamitous. They would certainly derail a lot of personal objectives for the young person. Our messaging is to have people equipped with this knowledge so they don't take that course on board. Now, there was a study out of Canada in the Journal of Child Psychology and Psychiatry, and they have said the psychotic-like experiences are defined as experiences of perceptual aberration, ideas of unusual content, and feelings of persecution. And the leader author here, Josiane Burkek, reports that our findings confirm that becoming a more regular marijuana user during adolescence is indeed associated with the risk of psychotic symptoms. And this is a major public health concern in Canada. Vulnerability to the harmful effects of marijuana appears to be even more pronounced for youth poised to interact with psychiatric and other mental health care treatment providers because of the existence of neuropsychiatric risk factors. This combination of facts suggests that there is a momentous storm coming towards us of the upcoming need for psychiatric and addiction services that we have no clear way to adequately meet or prevent. So that's the latest out of Canada by authoritative people, attributed to Elizabeth Osage, MD, FRCPC, ABPN. So there are our areas of concern and our messaging for today.
Yeah, just again in layman's terms around marijuana use as well, is that and a lot of people don't really understand this, is that they believe it's the same kind of drug that was around in the 60s in the Woodstock days and the hippie power. If we look at the THC content, which is the psychoactive ingredient, the delta-9 tetrahydrocannabinol, one of the 400 cannabinoids in marijuana. Back in the 60s, it was between 1% and 2% potency. In the 80s, it was between 4% and 6%. Today, in grown product that we see on our streets today, between mid-teens to high 30%. And if we're talking the concentrates like the dabs, the butter, the shatter, etc., you can be looking from anywhere from 80 to 99.9% potency. And in some cases, they advertise it's 100%, so available through the web, etc. And we may not think, well, what does that matter? Until we understand where the receptors in our brain are that respond to that THC and what it binds to. And it's very close to our areas of the brain that deal with our perception of reality. So the higher the THC concentration impairs our sense of reality. So what we see with working with youth and adults as well that are using marijuana, particularly with youth where the brain is still developing, with this higher concentration, we're seeing within 5 to 6 months of marijuana use, it doesn't have to be heavy use either. We are seeing psychotic breaks in young people now, symptoms that you wouldn't normally see in someone unless they were using for 10 years. We're actually seeing in very short periods of time because we've got a very different drug today than what we ever did. So sometimes as a young person, we talk to an adult, maybe a parent or a grandparent, and maybe they have had some experience around marijuana, and they'll talk to you about, oh, well, you know, I just got a bit tired and got the munchies, went to sleep and everything was fine. But we've got a different drug today, and that's what we need to actually understand. So the impacts, as Dan was saying, with the psychosis, if we happen to have genetic loading or biological loading in our genetics from our family members, it doesn't mean that we're going to experience that unless we have a stimuli in our life or an event that triggers it. And so that could be trauma, or it could be a whole range of things, but it can also be drug use. And if we're talking something of the THC concentration that we've got today in our cannabis, it's very high that can be triggered from that. So we need to, again, be educated in this area so that when we're making choices, we're free to make our choices, but we're not free from consequences, and some of them can be lifelong. And particularly when we're dealing with mental health, it's not favourable to be continuing in that space. I hope that helps to bring some layman's terms to that aspect as well.
Thank you. Thank you very much, Tanya. What's come to mind in terms of the human condition and how drug taking can have a lasting impact? The Drug Advisory Council has established a unit that we call Touchstone, and it's a means of providing support for the people who have been directly affected by somebody who has taken drugs in a setting, perhaps they share a household, family members, and so on. And sometimes the consequences are particularly damaging. So in terms of providing support for what we call the grieving and aggrieved families of the drug-affected, Touchstone has come into being, and hopefully in the public domain you'll be hearing more about our work as we course through the development of that unit as a charitable organisation. But I'd just like to bring one story into sharp focus. One of our team has joined us, and her experience was struggling with her son, who was encouraged at school when he started high school, year 7, to start taking marijuana. And these are the sorts of things that concern us right now in the beginning of a new school year here in Australia. And I'm asking for those who are listening, watching, to actually be aware of the fact that young people starting at school could be under pressures, and those pressures might be some things that they're not prepared to share with you because they really don't know how you'll take it. So be alert to the fact that sometimes young people can be pressed by a more senior student to take on board drug taking. These are the realities, and this is unfortunately how it starts. So the story is this young man became a marijuana user, and quickly a marijuana user has to become a marijuana dealer because it goes around in a circle and they need the means to purchase the product they are developing an increasing dependence on. It ends up starting at 13, going through a whole series of near catastrophic events, interfaces with the police, smashed cars, failure academically, major health problems, major damage to relationships inside the family. His mother was aware of the fact that he'd been missing out of the household for a long time, and she realised he was in the shower. And at that point, after taking drugs, marijuana, for 9 years, his kidneys and liver couldn't process the toxic levels of it any longer. So the way he relieved the levels of toxicity and, in fact, the pain that he was enduring at that point was to have a hot shower for more than an hour. And he collapsed into the shower, and his mother had to pick up a 22-year-old, 6'4" young man who'd collapsed in the floor of the shower, and the entire room was dripping an orangey brown stain, which is what his skin had to be the means of relieving his body of these toxins. And that led to him taking up a rehabilitation place, interestingly enough, with Teen Challenge. And after 15 months in a residential setting, we can say that he's a recovering addict. It's 3 years on, and may God bless him, and we wish him well as he courses through his life. But these opportunities to put people into rehabilitation settings, unfortunately, are few and far between, and the cost pressures on families who are not in a position to get such a place. It's quite an expensive process for 28 days in a private rehab, and we're always pushing for the fact that there are more rehabilitation beds, not just a few hundred here and there, but thousands more. Basically one to match everybody who might be abusing a substance and could possibly already be an addict, with like a matching bed so that they've got a place of recovery. That's another one of the things that the Drug Advisory Council, that's our quest. That's the things that we'll continue to be asking for. That's a story from the front. and it's very live. We wish this young man well in his recovery.
Thank you, Jan. So I think probably now is a good time to bring a bit of hope into the circumstance. So as Jan shares, that's not a unique story. You know, even just before I came here, I was on the phone with a young lady that is now, we've been connected with her for probably close to 6 years. And she's now just starting to come to the point where she is actually wanting some help. And we're having to walk through some pretty difficult choices that she's going to have to make to go into rehab. The reality is that for one person in addiction, it impacts about 10 people around. So we need to not have a head in the sand and not be scared to have conversations with people that we care about. So perhaps some people that are watching this are wondering, well, what do I do? How do I have conversations with my loved ones in this space? Number one is you need to be educated and not hide from it. It can be a scary topic, but the reality is your love for that person should overwhelm that to go and actually get some research and understand about, you know, if it's vaping or marijuana or, you know, mental health, etc., and start having conversations, you know, from early on. To make it normal to have conversations about how you're feeling, you know, to stop, spend time, and to have big conversations sometimes and make that a natural, normal process in our families and our relationships with our friends as well. Sometimes, you know, we can see in the lives of someone else better than we can see in ourselves. I know from my personal experience, I never wanted to put the mirror up in front of me and to look at that. Other people would speak into my life, but I wouldn't necessarily listen to them. I thought I had it all together. And from the outside, it kind of probably looked like I did, still had a career, etc. I was doing very well, but inside I was a mess. So, you know, understanding that we can sometimes see more in someone else than they can see themselves. So not giving up on them, still having conversations, expressing love. Sometimes you need to speak 43 times, 47 times into someone's situation before they're actually going to listen to you. And each time, my recommendation is that we say that, you know, we love you, we care about you, particularly when I'm going to support you, I'm going to support you with healthy choices and healthy options. So not supporting, because one thing that people with addictions is we become key manipulators. So we understand all our families, all our relatives, all our friends' hot buttons. We know how to manipulate them. We know how to get what we need from them. So from everyone outside, we kind of keep everyone separate from each other. So we don't want Nan talking to mum and we don't want dad talking to mum, and because that way we can control the situation. So having open, frank conversations. Sometimes we have to put boundaries in place as well, not become enablers ourselves, which is painful, particularly for parents or grandparents of a young person, because we want to protect them. But the reality is when someone is in an addiction or a life-controlling, and it's at varying stages, we need to hit an uncomfortable time where we are wanting to seek help. So the sooner, and we call it reaching our bottom. So the sooner we come to that uncomfortable place where we don't like what's going on in our life at the moment, we'll have impetus to change. So where someone is stopping us because they love us, so they want to help us from reaching that point, then the further away that person is going to be from getting help. So encouraging people that are, you know, alongside someone is to be mindful, look up around what enabling is, how to put boundaries in place to have conversations in that area as well. There's a lot of professional help out there as well. And the reality is for those as, you know, our family members that are dealing with that, there's a lot of shame and guilt attached to that, both for the user and for family members not wanting to address the consequences. You know, we know what we've done, we know things that we've done, and it's painful to face. But the reality is that every journey starts with a step. So we need to have that courage to have a conversation with our loved ones, but also if we're in that space to, accept and take accountability of our own actions as well, because there is some hope for us. We don't have to stay in that space. And it's a painful, dark place where sometimes we feel so isolated and alone that we don't think there is any, and we don't think we're worth it. But I can tell you, you are worth it. It is worth sticking by our loved ones, but putting boundaries in place and keeping encouraging that sometimes we need a little bit of distance to make sure our rest of our family is okay, so that we're not transposing onto the other children in the family or the relationships in that family as well, because the person with the addiction is making their own choices and you can't control them, you can't stop them, they need to make that choice themselves. But if we can help them get to a point where that's their bottom, that's a consequence they don't want to live with anymore, they want to change, then that's what we need to help to encourage to bring forward.
Thank you for that lovely, hopeful message, that positive message, Tanya. One thing that has come to mind when we're talking about the various delivery systems of drugs is the fact that what's quite prevalent and it's starting to arrive in this country. In the United States, with the legalisation of drugs and a lot of retail outlets to be able to freely buy it, that running parallel with that are a lot of edibles, and our concern is that there will be an increasing lot of edibles, and people might feel that taking drugs is a nice way of having a block of chocolate with 10 milligrams of THC loaded into it. So if you've got a bit of a positive feeling towards chocolate, you might find that you're having quite a load of the drug if you're starting to use that as a delivery method. Another one that worries me is the notion of gummy bears. Everybody probably eats gummy bears by the handful and they're readily available. Parents have even got the opportunity to have gummy bears as a means of giving children vitamin tablets nowadays. And gummy bears could be in a bowl on a coffee table in the middle of a living room. But there's two types of gummy bears. There's gummy bears without spray of THC on it, and there's gummy bears that you wouldn't mind sharing around amongst the family. So there's been a number of instances rather, in the United States of children being poisoned after eating gummy bears that are being sprayed with the most toxic component of the cannabinoids, THC, sprayed on a gummy bear. Other products abusing branding would be if you get a little packet of a breakfast cereal that you could open up the packet and pop it in the toaster and warm it up and eat it on your daily commute to work. It's a Kellogg's product. They're called Pop-Tarts. Well, the people who like to deliver cannabis as an edible have taken on that and aped the product design, look and feel of it. They don't call them Pop-Tarts. They call them Pot-Tarts. So your breakfast cereal can be laced. So some people I think that's a very good start to the day. We would like to counter that and say, please don't have Pop-Tarts. So there's a lot of clever manoeuvring, and one of the points I would like to make is in all of the drug space that's going to affect individuals, going to affect families, is affecting families and individuals, is having an impact on mental health. That is, even a prosperous society like Australia is finding it hard to look at all of the mental health issues, providing a means of people having proper care, even in our society. Alerting people to the risks, being persuasive of them not to go there in the first place, to reduce risk-taking behaviour is a really good way forward. And so we say quite often in what's being promoted, made to look benign, made to look okay, made to look cool, is, we would like to say, take a deep breath, read widely about the subject matter, don't be fooled. And for those people who like to follow a trail back to the origins of where a particular message is coming from, it could be glamorous, could be everywhere, could be very cleverly designed to attract your attention, hold your interest for you to remember 5 major take-home points. To always follow the money. Follow the money. There's a lot of money to be made out of the misery of individuals and our society. That's another plank that if you might take home message for you today, follow the money. Tanya?
I think it's time to actually move on to our Q&A. So we've just got a couple of questions that our audience has submitted. First one, actually, can we talk a bit more about the risk factors of drug addiction? So like we talked a bit about social pressure, so like your peers, and like, is there anything else that we can touch on today, like income or things like
that?
Well, look, there's a lot, and we're all different, and we all come from different backgrounds and different environments. So for young people, particularly one of the big ones is pressure, so peer pressure. And particularly in a lot of the schools that I'm in and talking to young people, they will highlight that where their identity is placed, where they fit in this world, they desperately want to be connected. And so to be accepted by their peers is really important, and particularly in those developmental stages as well. That's, as humans, that's where we want to fit. So that is a big one. But there's other risk factors as well. So perhaps generationally, maybe from the environment that we're in, that, you know, our family uses substance for coping. So maybe it's having a few glasses of wine or a few beers to come home after work to just calm down and not think about the pressures. That becomes normal. Or maybe someone has more significant substance use issues, having experienced trauma, for example, and not actually have got help or to talk to someone professionally about that, to walk through that. So could be using substance to numb that or not have to face or deal with that, to just push it down and hide. There's so many, look, there's a lot of risk factors. That's just a few nutshells, but the reality is that it comes down to is we're not actually designed to use a substance to deal with how we're feeling. We're supposed to connect, talk, explore, discover, and find healthy ways to build resilience and to walk through that. But we can circumvent that by using a substance to temporarily seem to fix our problem, but not really. So it's just going to lead to more issues down the path, and some of them are irreversible. We can't do anything to recover from that.
Yeah, absolutely. What was, I think I had another question. Do you know of any new studies or research on treatments for addiction other than rehab? Just off the top of your head.
Yeah, there's well, look, there's lots of different conjecture, and at the end of the day, through our experience in rehab and working, you know, literally every year through Teen Challenge globally, 25,000 people graduate from the program. So that's a lot of people that working with every year. So in our experience, that connectivity with other people, you know, those friend groups who we're allowing to influence us, learning healthy coping strategies, learning to talk to people, finding meaning in our life, something that we can anchor ourselves to that's bigger than ourselves. That's where we get the drive and the positivity to move forward. So that's where we come from in that area.
I'd just like to make one quick comment on that.
Yeah.
One of the things that the Drug Advisory Council is embarking on is with authorities at professorial level on bringing together research into the application of music therapy and rehabilitation. And there's quite a ripple through that community, and we're going to be having further dialogue on that very topic during the course of this year. So I could probably say watch this space because there's some good stuff coming out of countries like Norway right at the moment, and the Scandinavian countries often lead the way in social policy research and initiatives. So
Very exciting.
there you go.
Yeah.
And also I think too with rehab, like everyone's different in the journey and how, like I never went into a residential rehab program. I found something that was more important, like some meaning in my life for a change that actually pulled me through. But everyone's different. So residential might work for someone, day program might work for someone, seeing a counsellor might work for someone else, just completely switching your geographical situation and your friend groups could be enough for someone, having a mentor. So everyone's different in our journey through that space, and also depends how far we've got down the line too.
What if, how can you urge an addict to get help if they are resistant to it, or like even a child?
So I'll speak to that one, and you can add some if you want to there, Jan. So in my experience and what I have observed is that the reality is we, number one, need to come to the realisation that we didn't cause the problem for this person. We can't control them or the situation, and we ourselves cannot cure it. So if we need to come to those hard realisations to start with, the solution is with the person. What we can do is, and I alluded to that before, is that we can support that person in our interactions with them to speak the truth in what we're seeing, but not in a hurtful way. So if we, like when I'm talking to young people and say, you know, has anyone had their mum or dad nagging at them to, you know, something they don't like about them, and does that give you the impetus to change? And there's like, no way, I'll go do it more. So if we're doing that, be mindful of how we're doing it. So take our feedback back to like the behaviour, not the person. So instead of saying, hey, you're an addict, or you're a bad person, or, you know, turn it back to, you know, and some young people do this even with their parents. You know, parents might be smoking, for example, is that I don't feel very safe when you're drinking, or I don't like the person that you become because that's not who you are. It makes me feel this. Or I'm seeing this in you when you're doing this. So, and again, you may have to say that multiple times, but always saying with love, like, I love you, I care for you, I want the best for you, but I'm seeing this happen when you use this. It's different to who you are, and I don't want that for your life. and I want to help you, you know, can I organise for you to go talk to someone, or talk to me about how you're feeling. So it's a hard one, because we want it in reality more than they will to start with. But the other things you can look at is enabling and make sure you're not enabling the situation. So the individual has to come to a level of pain that they don't want those circumstances anymore. So whether that is you won't go pick them up at 2 a.m. in the morning anymore. You do it the first time, but warning them, if you ring me a second time on that, unless it's obviously a genuine circumstance, but because you've decided to go out partying or whatever and you've run out of money, then you need to find your own way home. And that can be tough, I know, because the mums and dads like won't sleep because they know, but we've got to put our rules or, you know, lines in the sand, and have some consequences that can help that person that we love come to the realisation they need to change.
Mm-hmm. Anything to add, Jen?
No, and I think that's a fantastic.
Yeah, I think that's a great one.
Mhm.
To stop enabling them. Yeah, give because I guess like we talked in a previous symposium that we had where gambling was the topic. Like oftentimes if you're with friends who always gravitate towards the casino or whatever,
yeah,
sometimes you have to be the one to be like, actually I don't want to go there.
Yeah.
And you know, kind of steer away from that.
yes,
So yeah, that's great. We spoke a bit about vaping before. What are your thoughts on vaping as a gateway to other drugs and the connection with age of use?
Well, that's something I'd like to have a response to. Look, vaping certainly is a gateway. It's a delivery system that some people who are heavy smokers and therefore addicted to nicotine, and a lot said about nicotine being hard to give up. And some people like to say that nicotine is harder to give up than other hard drugs, for instance. It might be for some people. I personally gave up smoking, going cold turkey with a longing in my throat for 2 weeks, and it was 1985 and hadn't had one since. So it's worth a bit of a struggle. Tough 2 weeks, but I feel good this other side of it. So the delivery system for ostensibly reducing your dependency on nicotine is anything but. And a lot of the cartridges for vaping devices they contravene regulations in terms of what we need to reveal in terms of the makeup of that product, and they do have nicotine. And unfortunately, people who are marketing these devices don't really want you to give up nicotine. They want you to keep on buying these cartridges. In addition to that, because we've had a world authority on this very subject in our webinar 2 weeks ago, Dr. Murad Ibrahim, who's a specialist in problems associated with vaping, and so there are a number of flavours and additives that actually, ironically, induce a really severe lung damage, bring on emphysema, and a condition that I hadn't heard this term before, but I hadn't dealt with a respiratory specialist at this level before. It's actually called vanishing lung. Vanishing lung, which sounds pretty incredible term, but it is a medical term. And so we're very concerned that young people, and I go back to young people, sometimes in year grades 5 and 6, especially young people migrating from primary school into school, they might be put upon by senior students to take up vaping. They could be accosted in the school toilets, in the locker rooms, on the way to or from school. So there's not enough being done by the education department or schools themselves. They seem to think that because vaping products shouldn't be sold, to children under 18 that they won't be using them, and that if you have adults not vaping within 4 metres of a school gate, that's safe for everybody's access and egress from the school premises. So these are funny, quirky policies where it seemed to be hitting the problem, like we say, over the wrist with a wet lettuce, that it's not addressing the problem. And unfortunately, vaping devices are becoming a delivery system for taking on cannabis as well. And this is sinister. And I can give you a statistic. It's a memorable one because in the year 2021-22, in the United States, 2,601 people, young people, died of vaping. And we don't compile the statistics in this country for the problems associated with vaping as in the US, so I've had to rely on the statistics from the US. So that's my response. Keep away from vaping, and just remember for parents, the little vaping cartridges might be kept in a school pencil case, so have a good look.
I think just adding to that, so they definitely are a delivery device, and they definitely are well, they weren't originally designed for, but they're certainly being hijacked and used. And when we look at, again, as Jan said earlier, you follow the money. If we look at some of the organisations that own the companies behind these, they also own marijuana companies, etc. Marijuana product is definitely available for vapes, which can be purchased online. It's colourless, you can't smell it, so you would have no idea that your young person is using that. And there's other illicit drugs that, you know, if they can be liquidized, they can be used in a vape. So just that, as I mentioned before about that release of the dopamine, that is a rewiring of your brain using the reward system, which is gearing us up for addiction. So like I mentioned before about the young people believing around anxiety, etc., that you use a substance to help deal with a symptom, seems to help. When you're coming off it, it's worse, so you go back to the device again that sort of helped. It doesn't help as much, so you go more this time. That's your cycle of addiction happening there. So it is definitely a gateway. All the research is showing us that. If a young person, an adolescent, takes up vaping, then they are it depends on which research paper you read, but 7 to 10 times more likely to take up cigarette smoking. It's supposed to be a cigarette, you know, cessation device. It's proven that it's not the case, and moving on to other drug use. So that's a very real factor.
Absolutely. All right, well, thank you, Jen and Tanya, for your insights. Very informative, but I think that's all we have time for today. So I'd like to take a moment to thank each one of you for joining us on today's webinar on drugs and mental health, essential prevention and education strategies by Jen Kronberg and Tanya Cavanagh. If you'd like to rewatch this webinar, it will be available on our YouTube channel. Lastly, I would like to mention that in addition to educational webinars, the Mental Health Foundation Australia offers other mental health support services, including a monthly support group for a range of mental health conditions, as well as affordable counselling services through the Wellness Hub Psychology Clinic. And our services are available in person or online via telephone. For more information, please visit our website at mhfa.org.au. And that concludes today's webinar. Thank you all for attending.
Thank you.
Thank you.